What is Grafapex? Grafapex Treosulfan is a medicine used as a preparation treatment before stem cell transplantation allogeneic hematopoietic in patients with acute myeloid leukemia AML or myelodysplastic syndrome MDS. It is used in combination with fludarabine. Grafapex helps destroy any remaining cancer cells in the body and weakens the patient's immune system so that the donor stem cells are not rejected. Allogeneic hematopoietic stem cell transplantation (allo-HSCT) is when you receive stem cells from the blood or bone marrow from a donor who is genetically similar to you. Grafapex is given as an intravenous infusion that is given daily for 3 days. Beginning on day 4 before the transplantation, day 0 is the day you will have your stem cell infusion. It is used in combination with fludarabine therapy. How does Grafapex work? Grafapex mechanism of action is an alkylating agent that works by adding an alkyl group to DNA structure to kill cells, which results in depleting hematopoietic stem cells, anti-tumor activity, and its immunosuppressive effects. How well does Grafapex work? Grafapex was FDA approved after positive results from the clinical trial MC-FLUD-T 14L Trial 2 NCT 00822393, which demonstrated an increase in overall survival OS for Grafapex compared to busulfan. Grafapex side effects. The common Grafapex side effects are muscle and joint pain, 39% inflammation of mouth or lips, 38% stomatitis, fever, 34% nausea, 33% edema, 29% infection, 23% vomiting, 22% rash, 17% diarrhea, 17% headache, 16% febrile neutropenia, 15% abdominal pain, 15%. The above common side effects are the side effects that occurred in 15% or more of Grafapex patients in study MC-FLUD-T.14L Trial 2. This medicine also has caused non-hematological laboratory abnormalities grades 3-4, including increases in alanine aminotransferase, gamma-glutamyltransferase GGT, bilirubin, aspartate aminotransferase, and creatinine. Who should not take this medicine? You should not use this medicine if you have a hypersensitivity or allergy to any of the ingredients in this medication. Before taking this medicine, tell your doctor or prescriber about all of your medical conditions. How will I receive this medication? Grafapex is given as an intravenous infusion every 3 days starting on day 4. Day 0 is the day you will have your stem cell infusion. Grafapex and fludarabine infusions are given before your allogeneic hematopoietic stem cell infusion. Grafapex infusion is 3 doses given from day 4 to day 2. Fludarabine infusion is 5 doses given from day 6 to day 2. You have your hematopoietic stem cell transplantation on day 0. You will usually be prescribed an anti-nausea medicine before your first dose of Grafapex and continue until your last dose. Dosing information. Recommended Grafapex dose is 10 g by intravenous infusion daily for 3 days. Starting on day 4. It is infused over 2 hours. Day 0 is the day of stem cell infusion. Grafapex is available as 1 g vial and 5 g vial Treosulfan as a lyophilized powder in a single dose vial that needs to be reconstituted.